Hey everyone, it's Helen here with Health and Hope with Helen. If you haven't had a chance to subscribe, please do. I'm relatively new to YouTube, but I have made a handful of videos and hopefully some of them will be informative to you. And if nothing else, hopefully some of them will inspire you. So I'll just get right to it. So today I made a list of things that you may want to have on hand if your doctor has told you that you're going to need to have a hysterectomy. I had a hysterectomy in 2012. I had a full hysterectomy, meaning they had to take out my ovaries and they took out my uterus. And at that point in time, I had to be put on hormone replacement therapy. And so I was only still in my early 30s, and that was definitely a tough pill to swallow. There's lots of different options that you can get on after having a hysterectomy, and your doctor will decide what is best for you and what dosage is best for you. For me, I ended up getting put on a hormone replacement therapy patch, and it was Vivel Dot, and I'm still on it to this date, and I probably will be for many, many more years. However, we haven't had to change my dosage. I have a very, very low dose of the estradiol, and it just works perfect. But again, everybody's bodies are different. Their doctors may suggest different things. And so I know there's a lot of creams, there's patches, there's probably pills. So there's a little of everything. But for me, the hormone replacement patch has been amazing. I only have to change it out twice a week. I change it out on Mondays and Thursdays. It's relatively easy, and so far so good. And that was at least like 9 years ago. So far so good, doing good. So the thing that you'll want to have on hand though, probably prior to and post surgery is you're going to want to have meals, everybody. That was one of the best things that anybody could have done for me during that time, was to have home cooked meals. So if you can prep yourself some meals, maybe some chicken pot pie, chicken noodle soup, chicken and dumplings, maybe some spaghetti. I recommend comfort food because you are going to be needing it. You're going to need the carbs, you're going to need the energy, you're going to want the salt, maybe some of the sugar. So if you can make up some meals, freeze them, or better yet, maybe you even have a spouse at home who could help you out while you're recovering and just cook them for you fresh. But if that isn't the case, I highly recommend having all the meals on hand so that you can just have somebody run over to the microwave or the stove, heat it up really quick for you, and put it in your tummy. So for me, that was huge. I had a lot of pot pie and I had a lot of bowls of cereal. But yeah, I also had a lot of friends and family who liked to make food. So they were kind and brought me meals. And so, but I still go back to thinking, wow, that was the best pot pie I had, or the best spaghetti I had, because there's nothing better than a home cooked meal when one, you don't have to cook it, and two, you're recovering. So meals, you're definitely going to want to have that on hand. Secondly, guys, I cannot stress this one enough. You're going to want to go get a bottle of it now if you're about to have surgery. Colace, okay, which is a laxative. When you have had a hysterectomy, there is no words for the pain that will be involved when you have your first number two. Okay. I know that this may be TMI for a lot of people, and hopefully if you've had one, or maybe, when you have one, maybe you'll be one of the 1% who won't have this issue. However, to avoid any complications, because you're just having a major surgery, you're going to be under anesthesia, your diet's going to be different, you're going to be on a lot of pain medication. So there's going to be a lot of things that are going to be throwing off the GI tract that's going to cause some constipation. So the best thing that you can do when you get home is start taking Colace. Now, granted, you don't want it to go to the other extreme. So again, look at the bottle, follow the instructions, talk to your doctor. But I wish I would have known that about 5 days prior to starting to take the Colace. Nobody really told me that. And so I'm helping you and I'm telling you, because I could have avoided a lot of pain, a lot of discomfort had I known that. So go and get Colace. And I know there's a lot of other laxatives out there, guys, but I feel like Colace was the absolute best. I've tried other ones in the past, so I'm not a spokesperson for Colace. I genuinely 100% think it was the one that worked the absolute best for me over all of my surgeries. So yes, get some Colace, have that on hand, have it right there next to your bedstand, really. Okay, so let's see. Oh, another goodie that you're going to need on hand, you guys, is one of those clippers, one of those sticks. You know what I'm talking about. You can get them at your local Walgreens, or probably in any grocery store in the aisle where you'd get your medications and, surgical tape and this and that. Those clip things, they're long and they have like a little clamp at the end, and you just press this little handle and it picks things up for you. So if you have like a back surgery, or if you've had a hysterectomy, or really a heart surgery, anything, any type of surgery where you're not going to want to bend or you're not going to want to exert yourself, this little stick thing, you can pick up everything. I kid you not. You can get the socks, you can get the paper, you can get your magazine when it drops. You can grab your medicine bottle if it drops on the ground. You name it, your blanket. You can pull it up nice and gently and slowly with the clipper. I think they're like anywhere between $8 to $15. Very affordable, and you're going to want to have one of those on hand. It's going to be your best friend for at least probably 2 months, no joke. So go get yourself one of the clippers. That's another thing, just have it on hand, have it at your house, have it ready to go, and I'm going to save you trouble, so you're not going to have somebody go out and get it for you by day 4 when you're like, I can't bend over, I can't move, I'm so uncomfortable, or I throw out my back now. That was something I did deal with after having my hysterectomy. I ended up with back problems because of my core. I no longer had that strength in my core anymore. And so it was something so tedious, but I could bend over and grab a shirt and my back literally would go out, and I would have to spend 2 weeks like trying to heal it up. Or I'd be leaning over to grab a cup of coffee, and again, my back would go out. So I mean, crazy stuff. So the importance of, after having your hysterectomy and once you're fully healed up, of strengthening that core is huge. And a suggestion is literally just to start walking or just being on your feet. My doctor asked me at one of my appointments a couple years ago, my gynecologist, he goes, what are you doing different? Your wall is stronger in here. And I said, well, I'm on my feet 6 hours a day working, 6 to 8 hours standing. And he goes, whatever it is, keep doing it because you're strengthening it. And I couldn't attribute like any type of like exercise regimen or anything. All it was me. Just standing on my feet and working and just kind of doing the normal lifting and bending and things that you would do at work. So if you can, get on your feet at least a few hours a day, and hopefully that will help strengthen your core as well too. Okay, so now we have the Colace on hand. The hospital is probably going to make sure that you have hormone replacement of some type if you're willing or able to take that. And then we've got our, the clipper, the Colace, and the hormone replacement. Okay, and so next you guys are going to need, let's see here. Oh, and we have our homemade meals too. I forgot about that one. Guys, you're going to laugh at this one, but this one is so hilarious, but so essential. If you can, get yourself some men's underwear. 2 sizes bigger than you normally are. And this one is not a joke. My husband's boxers came in handy. So if you don't want to go out and get yourself some men boxer briefs, or if you're not married and don't have a husband, so be it. You're going to want to go get yourself some big, gigantic underwear. Yours are not going to fit. You are going to be swollen, very swollen, and you are going to be sore, and you are going to be in a little bit of pain, probably a lot of pain for a few days. And so your underwear are going to restrict your belly. They're not going to even want to go over your belly, and they're going to be so unbelievably, incredibly uncomfortable. So the best thing that you can do is invest in a couple big sizes of underwear, or throw on your husband's boxer briefs. If he's a big guy, my husband is, his underwear were my best friend for at least 2 weeks. And you guys, I showed no shame. I would actually throw on those boxer briefs because nothing else, my sweatpants, nothing. I couldn't have anything over my waist because it was so swollen and so big. I would wear his little big boxer briefs and walk back and forth up and down the little sidewalk to the mailbox and back, just to get, because they want you to walk and get a little exercise, don't get blood clots, keep things moving, start strengthening yourself again. And I couldn't put on my pants. I didn't have anything. So I would just wear the underwear back and forth with a big t-shirt. Hopefully you have good neighbors. So yes, get yourself some big underwear. You're going to need them, and trust me, you're going to want them. Okay, so now we got the big underwear, and let's see here. Yes, another thing that you're going to want to talk to your doctor about is getting potentially a antibiotic on hand. When you get a hysterectomy, typically they will put a catheter in you during surgery. If you are anything like me, my body doesn't like catheters. The minute you put a catheter in me is the minute I get a UTI, and it's happened ever since I was young. It's happened ever since I've had my first surgery. I just happen to have that particular problem. So you say catheter, I already know I'm going to need an antibiotic. So something that you're probably going to just want to talk to your doctor to or about is like, hey, the possibility of if I get an infection or if I get an UTI or anything, because obviously they're down there, they're messing around, there's going to be bacteria, there's going to be lots of stuff going on. So that is just another thing to have on hand, because I did end up having a UTI and had to get on an antibiotic, which some of those are really hardcore. And a lot of people don't do well with those particular type of antibiotics. So you may want to talk to your doctor about that too. However, you're going to probably want to have one of those on hand just in case. And if you don't need it, you don't need it. That's great. That's awesome. That's perfect. Okay, so get the antibiotic, and let's see what else. You're definitely going to want to have a notepad next to where you sleep, okay? Preferably a recliner for at least the first, I would say, several days, weeks, if possible. If you can sleep on a recliner and you have a comfy one, maybe 1, 2, 3 weeks, it's going to be really hard for you to get in and out of bed, especially if you have a taller bed or anything like that. Even if you have the steps and stuff, steps are a real hard deal for a woman who's just had a hysterectomy. So if you can just be on a nice, comfy, cozy recliner with nice soft blankets and soft pillows, that's probably going to be your best bet. Something that you can just kind of shift like this a little bit and get in and out of. I know like we had a taller bed. So for me, it was definitely a few weeks before I was even able to get into my bed and get off my bed, because, you're probably going to need to use the restroom multiple times, maybe in the evening, and you're going to be on pain medication. And there's just so many reasons why you're not going to want to go toppling out of that bed and then injure yourself even worse. I mean, granted, I know people have went straight to bed after they've had the surgery. But if you have the option and you're more comfortable, recliner would be the way to go. I know it was perfect for me. So you might want to look into that as well. And like I said, the notepad to keep track of your medications, because you are going to be taking a lot of medications for several days around the clock. And so what I did was I would mark it down, like I had like the days, and then I would have like morning, afternoon, night. And I literally would keep like a little time, like, okay, I took the, extra strength Tylenol at this time or whatever, because you're going to be on probably some prescription medications for a little bit. They're going to make you like loopy. So, I mean, our family tries, they'll help out, of course they mean well, but they can't keep up with every little thing. And if they're not in the room or they're doing something else, or say they're not around, you may just think, oh, it's pill time, because you get ahead of yourself, especially if you're out of it. So just by keeping a notebook on like, okay, I took it at 9 a.m. I can take it again at 12, or I could take another one here, because you're going to be alternating for a while, probably between the Tylenol and between the ibuprofen and stuff. So depending on what your doctor recommends for you. So a notepad and times is going to be huge for you. That way you don't put yourself into a position that you don't want to be in. And then let's see, last but not least, you may want to get a heating pad for your back. So that will come in handy. I know for me, I love heat no matter what, but I told you I had so many back issues after my hysterectomy. For whatever reason, I had a lot of bruising on my back after my hysterectomy. And it was actually unexplained. They're like, we really don't know why you have bruising all throughout your back from your hysterectomy. So to this day, it's still like, a mystery. However, the heating pack really did help. I didn't really put it on my stomach a whole lot. I don't really know as far as that. That wasn't just something that even like sounded good to me. I didn't want anything touching my stomach because I was so bruised. So I just, really kept it central to my back after a few weeks of, healing up. But however, you may want to have one of those on hand. And then another thing too is you are going to want to have an assistant because you can't lift anything over like, I think it's like seriously 5 pounds or 10 pounds to begin with. You'd have to go check. I don't really remember. All I know is they said don't lift a gallon of milk. Okay, so however heavy a gallon of milk is, and you're not going to want to. You're not going to want to pull on anything. You're not going to want to push a vacuum. You're not going to want to lift anything heavy. People push this, guys. I've heard it and I've seen it. I actually know somebody firsthand who decided after maybe just a couple weeks she wanted to go to the gym and do her normal workout. And it didn't work. You're stitched up and the stitches came undone and she had a whole nother bag of issues and had to go into a whole nother major surgery because of that. So you want to follow your doctor's advice. There's no sense in pushing it. The world will go on. You can take the time off, hopefully, and hopefully you have a team of people around you, but the world will wait. You have to get healthy. You have to get healed up. It's a very, very, very major surgery. So honestly, take all the time you need to get yourself back on track and be patient with yourself. If I can offer any piece of advice, it's a whirlwind. You're trying to, your body has just went through something traumatic. It almost mourns the loss of your uterus. And if you had to remove your ovaries. So there's a mourning process of that. There's a definite healing process of that. Hormonally, you're going to be going through hormonal shifts if you had your ovaries removed. And especially if you were at a really, really young age as well too. So you're going to be going through so much. And so just be kind to yourself and be patient with yourself and give yourself that time to heal and to recover, if I can encourage you for anything. And time really does heal, you guys. It took me about 4 years until I really, truly felt better after having my hysterectomy. And I know you're thinking 4 years, and I'm talking about 4 years on every level, not just physically, but physically, mentally, emotionally, because it takes a whole toll. It takes a toll on your hair. It takes a toll on your skin. It takes a toll on everything. I would say 4 years until my body finally just felt good again, like normal again, where I wasn't having hormonal breakouts, where things were starting to heal up, where I wasn't having any more like little cramping and, that type of stuff. So it took a while. It really did. But now I can say it was amazing. I'm so glad I did it. I had endometriosis. I used to have terrible monthly periods. And so I'm doing so much better overall since I had it. But you do have to be patient. And if it's something that's out of your will, and it's just something you have to do, my heart goes out to you, because I know it's a really, really serious surgery, and it's not definitely something that every woman wants to hear. That's for sure. In fact, most probably don't want to hear that. But God bless. Thanks for tuning in. And I hope that some of these little tips helped.